Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. R. Srilata. She did her MBBS, MD from Bangalore Medical College, and then she retired as a professor, head of the Department of Immunohematology and Blood Transfusion Department from Bangalore Medical College itself. It's a rare for someone, the alumni of the college, working there and retiring from there is very rare, and I have also retired from there. I also did my MD and DM from there. So we are sailing in the same boat, so same pinch. And more than 3,000 donors, she has literally motivated them to give their donation. And now, after retirement, she is working in the BGS hospital as a professor, head of the Department of Immunohematology and Blood Transfusion. More than that, she has received the Lifetime Achievement Award, especially during Corona, as the COVID warrior. And more than that, now she is the present president of Indian Society of Immunohematology and Blood Transfusion of Karnataka chapter. Welcome, Dr. Srilata.
Namaskaram. Well,
Yeah,
thank you.
we
Thank you.
we all know that June 14th is the World Blood Donation Day. Tell us the importance of that first and why it was started, and then we'll talk to the viewers about the blood donation.
We all know our own blood groups, whether it is A positive, B positive. So this A positive, B positive was all been invented by a person called as Carl Landsteiner. It is his birthday that we are celebrating as gratitude, as well as it is not only the gratitude. The main motto was WHO motto was that they want to motivate us. They want to save the people who are in wanting of the blood, as well as the people who are giving the blood, their health also will be saved from so many diseases. That was
Mm.
the motto, and that with that motto every year on June 14th, WHO has been given us the theme also, stating as normalizing the blood,
Okay. Mm.
voluntary blood donation. So with
Okay.
that, we are
So this year,
celebrating
this
on
year
14th,
theme is normalizing.
normalizing voluntary blood donation. So,
Okay, okay, okay. Many a times, people are afraid of giving blood because
that's
I
right.
remember long, long back, in certain community, they don't donate the blood also.
That's true.
Their own son was dying due to the accident. The parents, though they had the same blood, they refused to donate. Then my husband and his student, Dr. Belliappa, they both of them they gave one unit of blood and they transfused and then they did the surgery also. And this is how the doctors have been sacrificing. But
Yes,
among the common people, the awareness is very less. So
very
please,
less. And
please tell them, is it difficult? How much blood they are giving? Is it dangerous? And how safe it is? You please explain to them.
so myth says a lot about, even though the blood donation is in need of an
Mm.
hour, nearly about 2% of the population is in need of the blood transfusion every 2 seconds. So, but people are not coming front. They have their own myths saying that it is very painful procedure. And first of all, to whomever we ask them, they say we don't have the blood. They are fear of
Mm.
blood donation. They should not
Mm.
at this technological days, one should not fear for the blood donation. It hardly takes 10 minutes to once the needle passes inside the body, the blood vessel, and to take
Mm.
out, remove the required amount. Required amount is just not even half a liter, which is
Which is
just 350
350.
ml. Yes,
Mm.
350 ml to 450 ml, they'll take it out. That
Mm.
should not be a problem. It will be as sweet as an ant bite. Now, my question is, who has not been bitten by the ant or the
And
mosquito? So one
and
should
that
not
too,
fear.
yeah,
Mm.
yeah. And
And
that too,
six
when you
liters
said
of blood.
350, yeah, when
Yes,
you said 350, and you
350.
said 5 to 6 liters of blood everyone has.
Yes, everyone
And out
has
of
it.
that, every minute 80 times our heart is beating.
Yes,
And what we are giving is only 6 to 7 beats of blood.
that's true.
And only that much is donated. So it is
Yes.
much less than what a woman loses during the
Yes.
menstruation. So they should not be afraid of that. So once they donate, how long does it take to recoup?
It the liquid part, it will just take 24 hours to recover back. And the blood cells, of course, RBC blood cells, it will take 120 days, that is 3 months. So that is
Okay.
how the WHO criteria, they have fixed not to harm the person who is donating also, so that he can carry on his normal regular routine work, as well as the blood should come to his body within short time, within the no time. And also they have made a fixed criteria, 18 years and above, and say 65 years still regularly. If they are donating 65 years, they can donate. So WHO has done it
And
very
once in 3 months. Once in three
once in
months.
3 months for the males. But
Okay.
considering that's what the menstrual cycle, females can donate once in 4 months, because
Okay.
200 ml of blood will be lost. So considering that also, they have fixed once in
Okay.
4 months.
And what are the contraindications that a person, if he has got like HIV or something, what are the contraindications that such people cannot donate?
Yes. First of all, since the diabetes has become the household
Very
problem,
rampant, yeah.
yes. So the diabetic persons who are on the insulin,
Insulin.
they cannot donate. And asthma people, if they are asthmatic, allergic, they cannot donate the blood. And BP patients, if they are on very long chronic from long time they are on medications, they cannot donate the blood. So the tuberculosis, of course, if they are on the treatment, and if they have finished the treatment, and from last 3 years, so they can donate. Short duration means even the extraction, tooth extraction, that is last 6 months. If they have done it, then we cannot take from them. Tattoo, especially nowadays, the youngsters are all with the tattooing and all these things. If they have got the tattoo done, they cannot donate till 1 year.
Why? Why?
Because the body will be, those are all the foreign body. The foreign body reactions will be happening in the body. So that
Okay.
reactions might cause the problem to the patient. So
Okay.
we do not want to have that. First of all, the patient is having some health issues.
Yeah,
With that
yeah.
added health
And
issues, we
and
cannot have.
also the hepatitis virus, if it is found, no,
Yes.
HBsAg, that
Yes.
is hepatitis B, and
Yes.
HIV, these are totally
Totally
contraindicated. Yeah,
contraindicated.
yeah, yeah, yeah.
We are
And
going to test that. Those tests, five
yes.
major investigations:
Hmm.
HBS AG,
Hmm. Hmm.
HBC, and
HIV.
hemophilia,
Hmm.
syphilis, and
Yeah.
malaria. These five things,
Malaria.
after donation, the blood will be tested. Then only it will be given for
Okay.
transfusion for the
Once
patient.
all these things are ruled out, then only they
Yes.
are given.
Yes.
Okay. And that too, you see that whether it is compatible or not,
That's
and
true. Cross
then
match,
only your
and then
cross
only we can
matching
do.
is done and all that.
Yes, people
Okay.
should understand that
Hmm.
if one patient is A positive, and we have 5 pins of A positive blood, while doing the cross matching, not all the 5 pins of blood might be matching that. To that extent,
Oh,
will
I see.
be cross matching. Will be done
Okay.
at all the cellular level. One should think
Hmm.
about that. It is
Hmm.
not given just by matching the colors or something. It is not so in today's era.
Okay. Now, when and how they can donate? This somebody, after listening to you, they want to donate. But what
Yes.
are the place where they have to go and how to donate?
My good suggestion is one can donate in the place where it is hospital based. Blood banks, they can donate it nearby. Every city, everywhere they can find a blood center. They can go and donate. But preparation is a must. They have to prepare from the previous night itself. They should have a good
Okay.
sleep, normal sleep of 6 hours, and then food. They should have. They should not starve. If they are on fasting or something, one cannot donate. So they should have good food in the night as well as in the morning. They should have good food
Good
and drink
breakfast.
lot of,
Yeah.
yes, breakfast, and then they should have enough of water before donating as well as after donating the
After
blood also.
donating.
Yes, they should have more of the liquid diet part, either in the form of normal water or as juice or tender coconut.
Or a tender coconut water or
Yes,
something.
yes,
Okay.
soft drinks only.
Hmm.
So they can have, and then that will be replenishing the liquid part of the blood within 24 hours.
Okay,
So that is
okay.
the part.
And there are what you call universal donors and
Yes.
universal recipient. What is that?
Recipient. So blood groups, there are five, six, eight major blood groups. Out of that, O positive, it is called as a universal donor. It can be
I'm
given
O
to.
positive. Yeah.
Yes, yes, that's
Yeah.
good.
Mm.
So your blood will be given, can be given to anybody.
Mm.
And then O negative is there. It is called as universal safe blood. That also it can be given to anyone, and they cannot receive anybody's blood. They have to take their own
It has
O
to be
negative blood
negative
only.
only.
Yes,
Negative
negative
only.
only.
Okay,
So
okay.
like that. So eight groups have been designed, found out, and of course, in today's technology, more Bombay blood group is also there, which people have
What is
not heard
that?
about
What
it.
is that?
That is one of the blood group which is found out in the India, Mumbai, 73, 1973, it was found out. So from that time, people amongst the people, very rare people who are blood group has been found out to be a Bombay blood group from that time
Okay,
onwards. It's a
okay,
very
okay.
rare blood group. Like this, so many other
And for
major
them, only Bombay blood only has
Bombay
to be
blood
given.
group,
Nothing else
yes,
can be given.
nothing else will match.
Okay, okay,
And there
okay.
are minor blood groups also,
Hmm.
A1, A2. So many blood groups are there. Nearly 300 and odd blood groups, minor blood groups are there.
Oh, wow. I
Yes.
didn't know that.
So
Ah,
we have to
okay.
match to that extent. It is
Okay,
not
okay.
by the earlier years, they used to match only by, it is not so. We have
Yeah.
to match at the cellular level, very cross matching means to that extent. If it
So
is
that
not
there is
matching,
no mismatching is not there.
mismatching
Okay.
discrepancy
Yeah.
cannot happen to
Yeah.
that
Oh,
stringent level.
yeah.
We do check
I know
the
one of our
presence.
patients, he was the editor of Kasturi Karmavira, and he
Okay.
came with hematemesis. We donated almost 22 bottles of blood. I
Yes.
was there. And the
Yes.
23rd, I had finished my duty and gone, and it was a mismatched one. And then
Oh,
he went into shock and anuria. And that's how we
yes.
know every bottle, every time, we have to again mismatch.
Mismatch.
I mean,
Yes. Match,
match the
match.
blood, match
Yes.
the blood.
Patient's
Yeah.
blood is needed at every time of matching the other donor's blood. That
Yeah,
point where everyone has
lots
to
of
do so.
myths and thing are there in the minds of the people. So
Yes.
ultimately, as such an expert, what to say, like expert in this field, what advice do you give to our viewers?
Um, I was not aware about the importance of blood donation. I too became a blood donor at the age of 50 years.
Okay.
One article,
Hmm.
it opened up my eyes. That
Hmm.
article is nothing but as per the article, it
Hmm.
says every one of us,
Hmm.
all of us, whether female or the male, we should donate the blood to safeguard ourselves in today's world. As you are in the cardiological side, pediatric
Yeah.
cardiologist, first cardiologist. Uh, Nowadays, the people are dying of the cardiac heart attack, myocardial infarction. So
Hmm.
to come out of this, the only thing is we need to donate twice a year,
Yeah.
irrespective of the gender, twice a year if we donate,
So the
remembering
blood
our own
thinning
birthdays.
occurs and the blood thrombosis, the clotting of
Yes,
the blood is reduced.
yes,
Okay.
reduced. As well
Hmm.
as he says, our own RBCs, which has
Hmm.
got 120 days of shelf life, it
Hmm.
becomes cellular, the skeleton, it becomes hard. It cannot
Hmm.
flex in and move into the vasa
Into the
vasorams.
capillaries,
Yes,
small vessel
capillaries,
capillaries, and that
more
will clog.
smaller.
Yeah, that
Yes.
will clog.
And
Hmm.
once that clogs,
Hmm.
the underlying tissue will undergo infraction, and
Yes,
that is how
yes.
the
So,
myocardial infarction
so
or
the
stroke.
yeah, well said, Sri Lata. That means
Yes, ma'am.
by donating, you become healthy.
Yes.
And by donating to others, they also become healthy.
Healthy.
So it is
Yes.
beneficial for Swartha and Paramartha.
Yes.
So thank you very much
Thank
for
you, madam.
explaining so
Thank you.
beautifully to our viewers.
Thank you, madam. Thank you very much. Thank you.